underlying or underdiagnosed mental health issues, premenstrual syndrome. So that's like all these symptoms. This is very common. In 80% of women, this is seen. And this is nothing abnormal. When I say abnormal, I mean that this is not something like a disorder. It is something that everybody goes through. Abdominal pain, bloating, diarrhea, headache, and getting frustrated, or just very irritable. You ask me something and don't talk to me. So somebody is in that mode, especially before 2-3 days of menses and first 2-3 days of menses. So that 1 week of that month. The severity depends on many factors, but yes, it does take place. And premenstrual syndrome, as I said, is very, very normal in 80% of women. Premenstrual dysphoric disorder, which is like a higher level of premenstrual syndrome. This is something which is also included in the mental health disorder guidelines or booklet that we have. How we have a diagnosis criteria for depression or for anxiety or any diagnostic, any psychiatric disorder. This PMDD is also from 2013. It is included in that. So which means it is a real problem. You can see the difference that PMDD is there only in 3 to 7% of women. It's not very common, but it is very, very severe, very severe. Wherein in PMS we just have sadness or just mood swings. Here we feel extremely depressed. Simple this thing that I have pain, I might have to sleep for an hour, but in PMDD you may not be able to go for work for 3 to 4 days. It's that severe. Suicidal thoughts may be there. Severe hormonal disturbance may be there in PMDD. So the moment you feel that this is something not normal, you need to then consult 2 people. Yes, number 1, I'm sure gynecologist. Number 2, psychiatrist or a psychologist, to just make sure that is it a normal premenstrual syndrome or is it a premenstrual dysphoric disorder, to say so. I will request you not to engage in any kind of self-diagnosis. That's not needed, please. We have people who can help us with this.